उघडत नाही. दुसऱ्या डब्यात गोड गोड बोलते मला खूप आवडतं. So this is about the birth fracture, that is clavicle injury in the 50%, which is followed by the brachial plexus injury, usually in the instrumental rotation of the vertex, and when there is a bridge presentation, there is a humerus and femur fracture seen in a child. Then a pathological fractures. These conditions leading to pathological fractures could be generalized. For example, osteogenesis imperfecta and metabolic disorder, etc. So localized to one limb, that is fibrous dysplasia, localized to the lesion, for example, a benign cystic condition of the bone, infection, benign and malignant neoplasm, etc. Then, pathological fractures usually result from previous trauma. Child abuse, that is battered baby syndrome, in 80% of the child abuse takes place in a less than 2 years of the age. And stress fracture are not very common, which is seen in tibia and neck of the femur. So pathological fracture, it is also important entity in the fracture, that it is generalized seen in a metabolic disorder in osteogenesis imperfecta. And when it is localized to the one limb, then it is in fibrous dysplasia. And it is localized to the lesion, that is in infection, in benign malignant neoplasm or in a benign cystic condition of the bone, and pathological fracture usually results from trivial trauma. That is, it is due to after trivial trauma. So, in a child abuse, that is battered baby syndrome, 80% of baby child abuse takes place in less than 2 years of the age. And stage fracture are not very common, which is seen in tibia and neck of the femur. Then the types of the fractures, that is green stick fractures. These type of incomplete fractures seen exclusively in children. Here one cortex is broken and other is intact. So diagram shows that radiograph showing a green stick fracture of the radius and ulna. So there is a X-ray which shows the green stick fracture of the radius and ulna. This is a type of the incomplete fracture seen exclusively in children. Here one cortex is broken and other is intact. Then the buccal fractures, that is torus fracture. This is a common in metaphyseal region and is due to the compressive force. And in this fracture, cortex is buckled and common at the distal radius, and the treatment is by plaster cast or Lutura type of the wrist plate. So torus fracture is common in metaphyseal region. It is due to the compressive force. So this is in this there is a compressive force which lead to the fracture at the metaphyseal region. In that cortex is buckled. So it is commonly seen at the distal radius. And the treatment is by plaster cast or Futura type of the wrist split. Then there is the plastic bone. That here the bone deforms but does not break and seen in paired bone. So there is a microfracture on the concave side. The fracture pattern of the fractures is that it is a simple or compound. The latter variety is rare. The fracture in either case could be transverse, oblique, spiral and comminuted or segmental. Clinical features is that the child complains of pain, swelling, deformity, and the child notes to use the affected extremity. So, when the plastic bovine, that bone deforms, but bone does not break. So, it is called as a plastic bone when there is a deformity in bone, but not breaking. And it is seen in the paired bone, that is tibia fibula, for example. And there is a microfracture in concave side. So, there is a concave side shows a microfracture. In the pattern of the fracture, that when it is simple or compound, the latter variety is rare, and the fracture in either case could be transverse, oblique, spiral, and comminuted or segmental. Clinical feature is that there is a pain, swelling, deformity. The child knows to use affected extremities. Then next is the investigations. So anteroposterior and lateral view of a plain X-ray of the affected limb is enough to make an accurate diagnosis in children. Treatment is that problem of treatment, that is the younger child is fretful and difficult to examine fully. Warrior parents and crying child pose problem. Many fractures are difficult to see and need X-ray of good quality. General anesthesia required for manipulation. Then circulatory compromises is relatively common. Redisplacement after reduction is common during the first week, and wound care should be the same as in adult. And overgrowth after long bone fracture is very common problem, and an overlap of 1 centimeter should be allowed. So, investigation in that anteroposterior, that's AP, and lateral view of the plain X-ray of affected limb is enough to make an accurate diagnosis in children. And the treatment shows that problems of the treatment. That is, when we treat such a patient that younger child is very fretful and difficult to fully examine, and parents is already worried. So, a crying child and worried parents possess a problem. So, many fractures are difficult to see and need X-ray of good quality. So, there is a GA, that is general anesthesia required for manipulation, and circulatory compromise is relatively common. So, there is a redisplacement after reduction is common during the first week, and wound care should be the same as in adult. And overgrowth after long bone fracture is very common problem, and an overlap of 1 centimeter could be allowed. So this is all about the torus fracture. They remember that the general rules in treatment of fracture in children is that angulation when less than 10% is unacceptable. Rotation will not be compensated and hence is not acceptable. Overlap of fracture site by 1 to 2 centimeter is acceptable as there is overgrowth following a long bone fracture, and correction is occur at the average rate of 1% in a month. So, general rule in treatment of fracture in children is that angulation when more than 10%, then it is unacceptable. And rotation will be compensated and hence it is not acceptable. But when there is an overlap of fracture site by 1 to 2 centimeter is acceptable, and there is a overgrowth following a long bone fracture. So correction occurs at the average rate of 1% in a month. So this is all about the fracture in the children. So today we stop here, and in the next lecture we will study about the conservative methods and the other points of the uh, fractures. So have a good day, and now we stop here.